This is a part of a bigger project called Reducing Losses and Adding Value. Participation plays a major role in determining success or failure of development objectives and actually their sustainability. If we neglect or if we give marginal emphasis to relevant stakeholders, our interventions could become unsuccessful. This is especially true in food security and nutrition security tasks because most of the tasks take place in a multi-stakeholder or social context. Our project is upgrading starch staples for improved maternal and child nutrition also occurred in that multi-stakeholder platform. So we asked who should participate in this project and why should that stakeholder be participating? For this purpose, we did stakeholder analysis. So we have this hypothesis, participatory upgrading of starch staples through different levels of involvement of maternal and child nutrition stakeholders could increase the potential impacts. And this part of the project will answer answers these questions: who are the maternal and child nutrition stakeholders in the area, and what levels of stakeholder participation are needed to increase the impact or relevance of the project. This study is important for us because it will help us to use our resources efficiently. Plus, it could increase the chance of success of our program or project. The project took place in Ethiopia, southwestern part of Ethiopia. We selected Jimma zone because it is characterized by food insecurity. So for making stakeholders analysis, we followed a procedure or a guideline outlined by Schmier 1999. It involves planning the whole stakeholder analysis process, then identifying key stakeholders. This involves literature review, consultation with experts, then adapting the tools that we are going to use during the process of stakeholder analysis. There are different tools, I will discuss about that. Then using these tools, we collect and record the information. One of the tools one of the steps is making interviews, and that helps us to make what's called the stakeholder table. We have also done participatory rural appraisal. This is mainly used in the agriculture sector, but we adapted it to fit into this project. It's composed of a team and some tools that are needed, like stakeholder matrix, stakeholder wheel, and rainbow diagram. Afterwards, after collection of the data, we analyze the stakeholder input. In this case, analysis means seeing the information that we gathered and making conclusions about different available stakeholders. And finally, the most important part is using the input that we got from the stakeholders into our product development project. So these are the tools: stakeholder matrix, stakeholder wheel, and rainbow diagram. Generally, these tools are helpful in showing the commitment, the importance of any stakeholder that you are dealing with. So this figure shows the power and interest of the different stakeholders that were available in there. And as you can see, there are 4 distinct quadrants. The high power, high interest quadrant, which includes mothers, health extension workers, and others. The second one is the high power, low interest group, including media, religious institutions, and Kabale. Kabale is the lowest administrative unit in Ethiopia. The third one includes high interest but low power in that setting, including research institutions and the home economics department, which is gradually disappearing. The last one is low power, low interest group, including most of the private sectors. This is the stakeholder analysis wheel. This shows the different sectors and what kind of role they have in maternal and child nutrition affairs. As you can see, there are more non-health related public sectors involved in that area as compared to the others. When we see the roles of each stakeholders, mothers, health center, health extension workers are closely involved in this maternal and child nutrition affairs. Majority of the others are having only supportive role, and the administrators, like government, they have a peripheral role. The rainbow diagram helps us to see who is affected, who is affecting this kind of project. As you can see, children are the most affected. Mothers are affected as well as affecting this kind of work. As you can see, the health-related stakeholders, like health extension workers, are most affecting this kind of project, and the agriculture sector is somehow moderately affecting the project, and the remaining stakeholders are least affecting our work. So we use this result and we come up with a level of participation. This is based on Wenger 1998. So there is a core group. This is the group who is enthusiastic about our work. It includes the mothers, the health extension workers, and others. The active participants, these are like the experts that are working in the area, including health experts, agriculture experts. Occasional participants are participants who appear only if there is something interesting from our side, like the health office, Kabale, NGOs, and others. The peripheral participants are participants who are deep-rooted in the society, the community, but they are not really engaged in maternal and child nutrition affairs, including religious institutions and traders. The transactional participants are outsiders to the community, and they are not that much engaged, like media, suppliers, and others. So the most important part is how do we use all this information in our project? That's product development, the upgrading of starch staples. Our product development project has 3 phases: the design phase, development phase, and production phase. It's a mix of research and development work. So during the design phase, we consulted most of the stakeholders. In the next phase, when we select the raw materials to make the product of, we consulted mothers, health extension workers, and others listed there. Then we learned that there is a lot of blending there to make complementary food. Then we consulted the mothers and experts how to proceed with this. And for the processing method, we consulted experts, the mothers, research institutions, and others again. And we have developed this product, and we have analyzed the nutritional quality of the product in collaboration with Ethiopian Public Health Institute. And we have tested it by involving the mothers who were there from the beginning. Now we are planning to involve or to consult or to engage mothers, small and medium enterprise in the production and distribution of these products that we are making. And we are also planning to promote it somehow using media. The most available one is, there is a Jimma University community radio that we can use easily. So what did we learn from this participation experience? There were some benefits, including we could get feedback on different aspects of the product development, as you have seen earlier. The other advantage that we got is different views of the different stakeholders, increased interest in project output, and as a food technologist, this is the first time I'm doing something like this, from the community to me or to the scientists. Previously, it was from the lab to the community. So it's a new experience, a new lesson for me. There were also challenges, difference between expectation and the reality. And there is also variation between assumed position of the stakeholders and real positions of the stakeholders. And we have also noticed some sectoral orientation. To the conclusion, involving mothers, farmers, health extension workers in decision making, engaging them, working with them regularly was considered important or really crucial. Consulting the experts, research institutions, health experts is also mandatory if you want to succeed. And deciding together with the decision makers like Abale and Health Office was also found to be relevant. I thank all the stakeholders that worked with us, and thank you for listening. Thank you.